about drugs. Though we are going to talk about the term drugs, there are certain disclaimers that I want to make in the beginning of this talk itself. Because generally we know that many times certain things come with disclaimers. Even when a movie starts, sometimes you see the disclaimers that if you see any resemblance, the story resembling to certain people, we are not responsible for it. Okay, but then here my disclaimer when it comes to drug abuse, my disclaimer here is the information exchanged in the session about psychoactive substances is for information, not for experimentation. There is a particular reason I made this statement or a disclaimer. Sometimes when I talk about certain experiences, certain people used to tell that, even I feel like experimenting it. But then that kind of an experimentation may not be really a happy experience, or it may not have a happy ending. So that's the reason I was telling. It's more of an information rather than an information for your experimentation. So that is the first disclaimer. And next thing, I'm not going to tell you what you need to do and what you should do. I'm not going to talk like that, because ultimately we believe, all of us believe, that individual freedom is there, and that freedom for making a decision is there. It lies with you. So whatever the decision you are making, my role will be just to give you an information so that you can make a wise decision based on whatever the scientific information you can, which you can get. Okay. So basically it is an informed choice or an informed decision that can be made after this presentation. And I'm not going to tell you what decision you have to make. So these are the two disclaimers I want to make before we move on to discussion. Then probably you would have seen that I have used a term called a psychoactive substance. One of the reasons is the term drug itself is carrying a lot of negative connotations. It has got a lot of stigma. It has got a lot of negative meaning. So what happens is that when somebody is referred like a drug addict, we have a different kind of outlook towards that person. We perceive that person in a very negative framework, a drug addict. So such kind of terms are not preferred in our scientific literature and in our clinical practice. And what we believe as a clinical psychologist, as a person who is working in the field of mental health, even I also prefer that the term should be more neutral. The term should not be for labeling somebody as an addict or a drug addict, something like that, but it should be perceived as something which is a commonly existent thing and which needs help. So that is the reason the scientific literature is using the term psychoactive substance rather than drug addiction, drug addict, like that. Okay, so I guess you got that concept. And what do you mean by psychoactive substance? I have taken a definition from our World Health Organization. According to this, a psychoactive substance is a substance that when taken in or administered into one's system affects mental processes, example, cognition or affect. So that's what these chemicals are doing. So basically all these things are chemical compounds. And these chemical compounds, when you are taken in or when it is administered to a person, it actually affects the mental processes of a person. Mental processes include a lot of things. It includes cognition, it includes thoughts, it includes our mood, our feeling, our affect. So all these things can get altered when a person takes in these kind of psychoactive substance or when it is administered to a person. So that is the major effect of a psychoactive substance. Instead of drug, as I was mentioning, we'll use the term either psychoactive substance or just substance, or another term we can use is psychotropic drug. There is a reason for doing that. There are certain substances are legal or certain substances are illegal or illicit or licit drugs. It doesn't mean that all legal drugs can be just taken like that. All legal substances can be taken. It doesn't mean that way. Legal substance generally means it is legally sanctioned. That's all. And an illicit drug means, or an illicit substance only means that legally it is not the manufacturing or the synthesis, manufacturing or selling of such substances are not legally sanctioned. So that is the basic difference. And both the substances come under the broad umbrella of psychotropic drug. So in scientific literature, again, we use this term psychotropic drug or psychoactive substance. Now we need to know, why is it important to talk about it? Ultimately, some people think that it is just an individual problem. Somebody is taking a substance, he or she ends up in a rehabilitation center or in a de-addiction center, or creates a lot of problems to the society or to oneself. So why should we talk about it? It doesn't it an individual problem? But actually it is not. It is an individual problem, but it can affect the society, and it is not just the society. Globally also, when we look at it, psychoactive substance use and the disorders associated to substances are very, very important for a discussion, very, very important for taking actions against it. Recently, there was a report in United Nations Office on Drugs and Crimes. It was released in 2020. And they told that there is a 30% increase in the abuse of drugs between the years 2009 to 2018, almost 30% of increase. And in that report, they were also mentioning that they are more worried. They're more worried that what is happening during this pandemic situation. Because all of us know during this pandemic situation, the drug transportation, sailing, all these things become very difficult, and that makes people vulnerable, especially people who have been using this, make them vulnerable go for impure substances and can cause a lot of health damages to them. They may go for new kinds of substances. They may experiment with new substances. So the real picture of this problem, we may get to know only after 2 or 3 years, once the pandemic is over or this COVID situation is over. So this is going to be a big danger, is what even United Nations is worrying, and all of us are worrying. Then drug abuse poses serious threats to biopsychosocial functioning of an individual and society. So something which I think I don't have to specifically mention a lot. We know that it affects our functioning. Basically, it affects our brain functioning. It reduces our ability to think in a clear way. It reduces our ability to solve our problems in a creative way. It reduces our judgment, making decisions. It can interfere with those kind of things. It can cause mental illness in a person. It can cause problems to our different organs like heart. It can cause problems to our liver. It may cause problems to our sexual functioning. So biologically, it has got a lot of repercussions when it comes to all these kind of substances. The same way, it can affect the psychological function of a person as well. So when the brain is affected, as I was mentioning, it can affect our psychological function in a major way. Our clarity of thinking, our speed, accuracy in doing things, accuracy in understanding things, retaining things in our memory. A lot of brain functions get affected, psychological functions get affected when we use these kind of drugs. Sometimes it can make us prone for psychiatric illnesses, anxiety disorders, depression. There are major psychiatric disorders like schizophrenia, bipolar affective disorder. Those are very, very severe kind of mental illnesses, mental disorders. So the person can become vulnerable in that way. Social functioning, no doubt about it. We know that a lot of aggression, violence, issues with legal system, road traffic accidents, a lot of things can happen. They create, they make, it's not intentionally they create, but they tend to create a lot of problems when it comes to social functioning as well. So that's how it is affecting the different domains of our life. Now, as I was mentioning, why it becomes a global problem? Why do we have to consider, and why do we have to sit and talk about substances at this time, at this evening? Why do we have to really bother about it? Why do we have to look at it from a global perspective? For that, we need to understand that a little bit of a history. A history is that, you know, that in United Nations, all the constituent nations come together and they start discussing about their plans for the entire globe. In such discussion, in 2015, these countries came together and they told that we should have an action plan. And this action plan is for what? That is to improve the human lives and to protect the environment. So not just protecting the environment, we need to improve the quality of life of each and every human being in this globe, in this universe. So it was a wonderful aim or a goal that UN had, and they wanted it to be achieved by the end of 2030. And this 2030, and they termed or named these goals or this action plan as Sustainable Development Goals. And they have come up with 17 such goals or 17 such targets that the nations should achieve, or nations should try to achieve by 2030, so that the quality of life of human beings are improved and our environment will be protected. Among these 17 targets, there is Sustainable Development Goal 3. That target is mentioning that good health and well-being is the aim of that target or that particular goal. And it has got 13 sub-targets. Among these 13 sub-targets, 3.5, the sub-target 3.5 says that strengthen the prevention and treatment of substance abuse, including narcotic drugs and harmful use of alcohol. See, that's the reason drug abuse is a major topic to discuss, because it has a global perspective, it has a societal perspective, it has an individual perspective. To improve the quality of life of the people, to improve the quality of the life of the people in the universe, and to protect the environment, we need to think of preventing, or if the problem is already occurred, we need to treat the problems of substance abuse, which includes alcohol and other narcotic drugs. Okay, so we'll be talking about what are those narcotic drugs, what are the different kinds of substances. Those things also we'll be talking. So I think you got the global perspective and why should we talk about it. Now, next question is, why psychoactive substances are so potent? Why are these substances very powerful? We have different kinds of food, but rarely we develop a kind of a dependence or only a craving for specific food. Or if we don't get a specific food, we become very much upset or we become irritated. Why are we not having all those kind of problems? But why do these kind of problems happen only with these kind of compounds or these kind of chemicals? That exactly takes us to a different discussion, that these substances has some power. I'm not talking about the power in that sense. It is very potent to make a person dependent on that substances. A dependence means that the person will have a lot of craving for that substance. And if there is an unavailability of the substance, the person may develop different kinds of psychological and physical issues related to that. Okay, so why does this dependence happen? For that, we should know that all of us feel happy. We feel happy whenever certain pleasant experiences happen. When we buy certain things, we feel happy. When we get a present or a gift from somebody, we feel happy. When we interact with our friends, with our family members, we feel happy. So how do we feel this happiness? If I want to get some responses from you, will I be able to see the chat also along with this? Is it possible for me to?
Sir, actually, I don't know, unless you change tabs, I'm not sure if you can see the response, because right now you can see only your screen, right? I can tell you if that something comes on chat, I can always read it out to you.
Okay, sure. So actually, I would like to get some responses from my participants or my listeners.
Sure,
What do you think? What makes this substances very potent?
Anybody?
It's hi, sir.
Hi.
So I think it is because I don't know. We read about things like these on internet. So they say like it can activate your neurological like networks, brain networks, in a way that a normal food doesn't. And from that we may get feeling good hormones like dopamine or all those good hormones that make us feel good. So that feeling of good makes us want to like reach out for it again, like if we are deprived of it in our normal surroundings, or our normal lifestyle doesn't give us that feeling, then we feel like if this is the option that I have to feel happy, then maybe I should take it. That may be the attitude. So I just shared my opinion.
Very good. So I think Jabin, if I'm not wrong, she has explained it very well. Okay, yeah, thank you, Jabin. And
okay, thank you, sir.
Yeah, one more chat is there. I think user tell that they are feeling very heavenly type, light type feeling. Yes, Anshman, you are right, because the usual term is high. So there is a feeling of high. Shahabana has responded, momentary happiness, not facing reality for some time. Okay. So there are chances you get disconnected with the reality. Not necessarily with all kinds of substances this will happen, but specifically with these hallucinogens, the kind of substances, these things can definitely it can happen. Yeah, that's a very good point. Yeah. So I think Jabin has actually made my task a little easy. Okay. In fact, she mentioned about a neurochemical. Okay, we call it as a neurochemical or a neurotransmitter because we have chemicals inside our brain as natural mechanisms to communicate between the circuits. Okay, so we have neurons, the cells, to communicate each other, and from the brain to other organs, and from organs to our brain. So we have different neurochemicals involved, and in a common language, if we can tell that there is a happiness neurotransmitter or happiness chemical, please don't mistake or misunderstand that it is a technical term. Okay, for easiness, I am telling it is a happiness chemical, and that happiness chemical is called as dopamine. So dopamine is a chemical which helps you to feel happy. In our brain there is a system, there is a circuit. We know circuit will be like different parts will be there, and it will be interconnected. The same way in our brain we have a circuit, and the circuit is called as reward system. And this reward system, how does it function? In this reward system, there will be dopamine secretion. The dopamine will be released more in this reward system whenever there is a pleasant experience happen. And because of that, we feel happy. And it's quite natural for us to do things which makes us happy more often. Okay, so that's how these substances are actually becoming more potent. Okay, what happens is that when we take these chemicals inside, it actually mimics, or it actually like come in the disguise of our natural chemicals, which will make us feel happy, and then make our reward system get stimulated. So our reward system gets stimulated because of these substances, and there will be a dopamine release, and we feel happy. So that's how this mechanism works, and that's how substances become very potent. I get a little bit of disturbance from a mic. Are there any mics on? Oh, thank you.
Mine was. Sorry, sir.
No, no problem, no problem. Thank you. Actually, this picture I want to show you. I'm not going to talk in much detail about this one. Okay, if I can just zoom it. Okay. Whatever I told, I just want to show you with the help of a picture. Not going to talk more about the anatomy, the brain anatomy and all. In an addiction cycle, we should understand that generally there are 3 stages of addiction. Okay, so the 3 stages of dependence is there. And in the first stage will be like the person is taking the substance. The person is binging on the substance. Binging means taking more than usual amount or taking in large quantities, because of which the person goes into an intoxicated state. We used to tell that because of alcohol, he's in an intoxicated state, he's talking. Okay, so this intoxication is the first stage when it comes to a person developing a dependence to any kind of substance. So what happens is that in an intoxication stage, there will be an overstimulation of this reward system, which I was mentioning. In this, we just need to know only 3-4 structures, brain structures. Just for, it's not that you need to remember all these things, but if you can see here, this is called as a structure called as basal ganglia. So this basal ganglia is involved in the reward. This is a major structure in our reward system. And this is a major structure in learning. It is also involved in habit formation. And these substances are going and affecting these structures. And here, if you see, there is a small structure here. Okay, this is called as ventral tegmentum area. Okay, this is the place where this happiness chemical, it is not happiness chemical in the literature. Again, I'm telling, it is for easiness, I'm telling, the dopamine is synthesized or manufactured in this small one, and it gets released in this structure, which is called as nucleus accumbens. Okay, so this is the structure. So that way, when a substance is taken in, there will be a release of dopamine in this area, and the person, and all these things are involved. There is a thalamus also, there is a structure here called thalamus, and all these structures are involved, and the person feels high. Then what happens? Then the person uses it in a more and more an increased amount of use happens, because of which the person moves to the second stage. Second stage is called as withdrawal or negative mood. To put it very simple, withdrawal means if a person who has been using this substance, like for example, I've been taking alcohol regularly, daily I've been taking, and one day I'm not getting, maybe it's a dry day and I didn't store the alcohol. Then today I'm not able to take alcohol. I'll be having a lot of physical problems, physical difficulties. I can have a lot of negative psychological effects. And that is called as withdrawal state. Okay. And this withdrawal state happens because when the person is using the substance more and more, what happens is that naturally released dopamine in this structure, that is the nucleus accumbens, gets reduced. The receptors in this structure gets reduced. So what happens is that the patient or the client or the person who is using the substance will have to take that substance to have this dopamine release in this structure. So that's what is happening with a person who is using the substance for a long time. So every day I've been taking alcohol. One day when I don't take alcohol, in my reward system, there is no enough happiness neurotransmitter gets released. And to get it released, I have to use that substance. And if I don't get that substance, we have a lot of negative emotions, which is mediated by a structure here called amygdala. Okay, this is the small part. And this amygdala is involved in our memory and emotions. So the associated negative emotions, when I don't get my cigarette, when I don't get my alcohol, when I don't get my cannabis, why do I become so irritated? Because it is stimulating my emotional center, that is amygdala. And that's how the person becomes a little irritable, anxious, violent when they don't get these kind of substances. So that is the second stage. Now, if the person is continuing to use it, then that person moves to the third stage, which is called as preoccupation or anticipation. Basic idea is that the person spends a lot of time in thinking about procuring this drug or getting this substance. Whatever I do, I just want to go and get it. If it is a dry day, I frantically run around. I may go for 50 kilometers to get one bottle of wine or one bottle of alcohol or some kind of substance. Okay, because I'm preoccupied with the use of it. What happens is that because of that, my most of other pleasurable activities get out of my mind. I may stop going and playing with my friends. I may stop watching TV. I may stop interacting with my family members. I may stop pursuing some hobbies. I may stop reading. I may stop studying. A lot of things get excluded and my whole mind gets preoccupied and craving starts to develop. And for that, these two structures are very important. One is hippocampus, again, to do with our memory, and this structure, which is called as prefrontal cortex and orbitofrontal cortex. These two helps us to control our behavior. It helps in our thoughts and actions. So all these brain circuits get altered. All these organs or specific organs inside the brain gets altered, and the person develops a kind of disorder, which is a psychoactive substance disorder. That's how it becomes a disorder. So the person may start by peer pressure, or the person may start as an experimentation, or the person may start it as a socialization, but then of late it becomes a disorder. And we should understand it is a disorder. We are not supposed to blame the person for that. Because generally in the society thinks that, okay, this is a volitional act. And if the person thinks he can stop it, very difficult. I'm not telling it is impossible. But when a change in the brain is something which helps us to behave, that helps us to think, helps us to retain memories, all these things get altered. And naturally, the person is not able to come out because of a disorder. So we can't blame a person who is using these substances. We can't blame. We can't tell that it is a moral issue. It is not a moral issue. It is actually a disorder which needs treatment, which needs proper treatment and care, with which the person will be able to come out of this problem. So we need to have an attitudinal change towards this problem, that the common language of drug addiction, drug abuse, it's not like that. It is actually a psychoactive substance disorder which requires a professional care intervention and I'm moving on. I would give you some time to ask the questions towards the end. So please don't, I'm just going on without asking any responses from you. Okay. There are 10 classes of substances. Basically, it is divided. These things, all of you will be knowing about these substances. You know, alcohol. Most of us would have seen that people taking, okay, or somebody would have used it. We don't know, okay. So alcohol, which has a basic chemical compound as ethanol. Then caffeine. Caffeine is widely used, and we don't really bother about it because we don't really consider it as a substance which causes problem, which is there in tea, our day-to-day coffee, chocolates which we are taking, maybe Coca-Cola, those kind of things and all. We can have this caffeine. Then tobacco, which is nicotine, which people use as cigarettes or they chew it. Different forms are there. Cannabis, another rampant, it has become very rampant nowadays. This ganja or charas, all these things, pot, grass. There are different terms for cannabis, and this cannabis is something which is becoming very rampant. And there are two potent chemicals inside cannabis. One is 9-delta tetrahydrocannabinol. It in abbreviation is THC. Okay, and CBD, cannabidiol. So these are the two potent chemicals which make the person develop these kind of problems, which is a substance disorder problem because of these potent chemicals only. Then opioids. Opioids has a lot of medicinal purposes also because they are analgesics. They are used in pain relief. But then this has also been abused, okay, illegally used. So opioids is another class of substance which has been used by some of the people or many of the people. Then there is something called psychostimulants. Psychostimulants like cocaine is there, methamphetamine is there, amphetamine is there. Again, these chemicals has got some chemical properties, but then all these medicinal properties. I'm not telling chemical properties. There are medicinal properties as well, but when we are prescribing it as a medicinal thing, it is not as such like somebody who is misusing a substance buying in the market. It is not like that. Okay, it is given in a different form, in a different amount. Okay, in a controlled way, these things are given, and that's the reason it becomes a little bit of prescribed drugs. Okay, so these prescribed drugs, which is prescribed by a medical practitioner, the authentic medical practitioner, also may be abused by people. Hallucinogens. People get different kinds of non-existing perceptual experience. I still remember there was one of my client. So what happened is that he uses something called ketamine. Okay, so ketamine is an analgesic used by veterinary doctors for the animals, and he takes that. It has got this hallucinogenic effect. So he starts hallucinating. He starts seeing things which is not there. So those kind of experiences people get in hallucinogens. There are inhalants like smelling the glue, smelling the whitener, thinners, paint, those kind of things. One of my client was telling that after smelling it, he used to see the globe, okay, the whole universe, the Milky Way. He is able to see. Okay, so that's how they tend to hallucinate, and it becomes a pleasant experience. Again, I'm telling it is an information, not for experimentation. Okay, so these are the kinds of experience and hallucinogens they have. But then, as one of the participant was mentioning, these are momentary, and it takes away from the reality, and the consequence is really, really bad after all these experiences. So there is a clear-cut decline in the quality of life, in the life of that person, not just that person, the people around that person happens. So there is a momentary experience of all these things, but then it has got really bad negative effects later. Then sedatives, hypnotics, and anxiolytics. These are something, again, which are prescribed for sleep issues. Nitrazepam may be prescribed. Lorazepam is there. Benzodiazepines and barbiturates come under this one. As an anti-anxiety drugs, people use this medication. So if you're taking it with the prescription, it is not a problem, because there will be a doctor to monitor whatever the changes are happening. Because this barbiturates and all can cause dependence. People can become dependent on barbiturates. So giving a proper, safer kinds of a medication, maybe a substitute as a benzodiazepine, which has to be given by a proper medical practitioner. But if somebody is using that over the counter without the prescription, they are going and getting it and using it, it can cause a lot of troubles for a person. So that is another class. And the 10th class is other unknown substances. Some substances people will be using, which we don't know. Okay. Again, coming to one of my client, what he used to do is, there is a plant called Devil's Trumpet, or Datura plant, which is actually available in our surroundings, okay, freely available in our surroundings, which is called as Devil's Trumpet. And what he used to do is that he used to put it into water and boil it, and he drinks that water. And the experience after that he used to tell that whenever he drinks that, he sees dead. And how he sees dead? Dead is a lady who is clad on a black robe and coming and standing in front of him by holding the hand like this. I don't know how he is so happy about seeing the death like that, but then he feels so happy about such kind of experiences, and he has been using it. But then ultimately what happened is that he lost his career. He went abroad for studies, and he was really doing really good, but then because of the use of multiple substances, not just one kind of substance, different substances, he ended up in a rehabilitation center. And he also had psychiatric issues. So then the treatment became very complicated. And obviously, we should understand that even after the recovery, there can be a little bit of disabling effects of these things. Okay, maybe with most of the people, a complete recovery is possible, but with certain people, it can become a little difficult. And there are certain in rehabilitation centers. When I was working in a rehabilitation center, we used to restrict all kinds of materials taken into the rehab. So sometimes people try to smuggle cigarette or cannabis inside the rehab, and this will be screened and will be kept aside, okay, or will be caught and kept aside. So what these people started doing is they started ordering for these deodorants, and the coffee which is served for them, they used to put the deodorant inside that, and they keep it for fermentation, and then they use it. Okay, so one way why I'm sharing all these things is that coming out of this problem is not something which we can do it by force. That is actually not a good decision. If we force the person who is using, if you restrict the person inside the home, yes, he or she is going to come out. No, it is not like that. Force is not going to help, because there are options around us to make use as a substance and feel all this high. So that way, it is not really a logical step to restrict a person or force a person to come out, but definitely the person should be helped and understand that this is a disorder. So if somebody is using, that person also should understand this is a disorder that needs help. There is nothing negative in this. Okay. Nothing negative in the sense I'm telling, it is not an individual's fault when this disorder comes. This has to be, the person has to show the motivation to come out of it. And with the help, people can come out of it. Then next thing, is all substance use considered as a disorder? No. We will not be able to tell that if a socialized context, in a socialization context, if somebody is taking alcohol maybe once, and that too in a little amount. There is a concept called controlled drinking, okay, which we generally don't propagate or we don't tell that, but there are situations where we need to prescribe that, a controlled drinking. But all these things needs a proper supervision, okay. So all the substance use, we are not telling it is a disorder. When does it become a disorder? When a person have an impaired control. I'm telling that I'll take only one glass of one pint, and then after that I'll stop. But what happens? So many of my clients who came to the rehab, they tell this. They're not able to control it. They think that they will start with in a moderate level, or even after going back from the rehab, they will continue in a moderate level. But what happens is that this moderate level, they are losing control. That's basically because of the brain mechanism which I explained. It is not possible for having such kind of a control for certain kind of people. Okay, so when there is an impaired control in terms of amount or length of taking substance, when there is social impairment, the person is preoccupied with only this and neglecting all other aspects of the life. Then risky use of substance, using despite having a physical or mental health issue. I may be having a liver cirrhosis. I may be having a fatty liver disease because of alcohol. Still, I am continuing. Then also we consider it as a disorder. And the pharmacological effects like tolerance and withdrawal, as I was mentioning, I used to take this much alcohol and I used to feel high, happy. Now it is not like that. Now I need to take a full bottle. Maybe after that, I need to take 2 full bottles, then only I get that high. And this is called as tolerance. So the amount is increasing. Withdrawal, when I don't take, I get irritated, I am not able to sleep, and sometimes even person can get convulsions, epilepsy. In withdrawal of benzodiazepines, in withdrawal of alcohol, you can see these things. Extreme withdrawal, okay, I'm not telling in all the withdrawals. In extreme withdrawals, the person can be vulnerable for epilepsy, even death can happen. I'm just telling about some of the interventions. These are professional interventions which are available. When it comes to psychological intervention, it is motivation enhancement therapy, especially somebody who is not thinking of leaving the substance. This therapy is more important to raise the motivation level. This helps. And cognitive behavior therapy, again, it helps in dealing with the problem, dealing with the cravings, dealing with the urges, and dealing with the difficulties of coming out of it, all these things. And guided self-change is for people who use in a moderate level. They don't have a major problem with substance, but still they want to come out of it. So they can have a self-directed kind of an intervention, and that is guided self-change. And contingency management. Contingency management has a rationale. The rationale is that, so for example, like the positives of leaving alcohol comes much later. If I am abstinent for maybe 1 week, 1 month, then only the health come back, all my mental health come back, my social circle comes to me. So the positives experienced after leaving a substance may be delayed. It takes a little time, a little more time. Whereas the positives related to taking a substance is very immediate. I get the high very fast. I get the positives very fast. And that is one of the reasons people are neglecting all other positive aspects of life and go for this easily available happiness or positive in the life. So in contingency management, we make sure that when a person is leaving this substance, we need to find alternative good methods, constructive methods to make the person happy or feel good. Okay. Then there is a high chance the person will not be going back to the substance. So that based on that only contingency management is done. And family interventions, which is called as CRAFT, also is done. CRAFT is a different kind. It is called community reinforcement approach, family training, especially if a family member in your house who is not listening to you, even after telling that, okay, we will go and do a consultation, the person is not willing for it. then we teach the family members how to deal with that person and indirectly build a motivation or indirectly persuade the person to go and take help or seek treatment. And that is called as CRAFT, community reinforcement approach to family training. And there are other family interventions as well. Then intervention for comorbid mental disorders is very, very important, because many people with the substance use, they may have comorbid condition. Comorbid means coexisting anxiety disorder, maybe they may be having depression, they may be having bipolar affective disorder, they may be having personality disorder. So those things also has to be treated. Unless we treat that, the person may not come out completely. Then we have pharmacological interventions, which are anti-craving medicines. There are different medicines like naltrexone, acamprosate, bupropion. Okay, there are different medications which helps in reducing these cravings. But understand that not just medication, it's a combination. It's a mental health professional team who has to deal with this problem. And now I'm coming towards the end of my talk. So I thought that I'll just give you a few tips, but then don't think that this is a substitute for highly indicated professional treatment. Please don't substitute. If needed, you should go for a professional treatment. There is no doubt about it. But then if somebody is thinking that there is a simple problem and you want to come out of it, a few tips which may work, which may not work also for you. Okay, these are the things. Like if you have decided, just write down your strong reasons for leaving a substance. Why do you want to stop taking this substance? Make your own strong reasons. Write it down. Don't just keep in your mind. Write it down. After that, either go cold turkey or decide a date for quitting. So either you just decide and stop it. Yeah, from now onwards, I'm not taking it. So suddenly abruptly you are stopping and continuing. Or you decide, okay, on such and such date, I'm going to, from that day onwards, I'm going to stop taking alcohol or stop smoking cannabis. Just write it down. Okay, that is another thing. Avoid all the paraphernalia. That is like if there is lighter, if there is a chillum which you have been using for smoking cannabis, just throw it away, everything. Make the environment clean so that you don't get reminders of these things. This is another thing. Then make a list of crave triggers. So there are situations or there are triggers, stimulus, which may be giving us a craving. Like, for example, I'm a little fond of chicken biryanis. So sometimes I used to decide myself, like, no, now I'm not going to order food from Zomato or from Swiggy. So what I do is that I just stop it. But then when I start watching some YouTube movies, the first advertisement may be a Zomato one, or I may get a message telling that, okay, there is a discount. Okay, this is just a simple example I'm telling. So such kind of triggers can be there, which gives us reminders. Try and avoid that. Make a craving plan. So there are some strategies which you can use, like distracting activity. When you get craving, distract yourself. Just do some activities which will take away your mind. Then talk to a supportive other, somebody who doesn't blame you for getting these cravings, somebody who understands that this craving is part of this disorder or part of this problem, and it should not be blamed the person for that. Should be supportive to that person. So such kind of a person, identify that person and talk to that person whenever you get this craving. Delay the decision. Always delay the first peg. That is one thing which we used to tell. If you think that, okay, you want to take that, you get a craving of taking first joint of a cannabis one. No, you tell yourself, no, maybe after 10 minutes. After 10 minutes, I'll have, not a problem. Then after 10 minutes, again, you tell that, no, maybe after 10 more minutes. So sometimes what happens is that craving is like a wave. It comes with so much intensity. And when you are able to delay it, it comes down. And it comes down and it subsides. Then you may not feel that way. Okay, so that is one thing which you can use. Another thing a simple thing is like changing your mobile and computer screen with a message like stay sober. Okay, we can our screen can be that way, stay sober. So it gives you keep reminding you that, okay, stay sober. Even you can think of changing the password, but don't share your password. Okay, so just type it like stay sober or something, okay, which is a positive statement which will help you to be away from it. Then learn drug refusal skills. There may be peer pressure, so we need to be assertive with them, and we need to be able to refuse their invitation to have these substances. So we need to learn that. Professionals, if you go for professional treatment, generally they teach you assertiveness training also, all these skills to deal with your problems. Okay. Yeah. So these are some of the references if somebody wants to read more about it. And just to conclude, I just want to tell this. I strongly advocate for a drug-free world. So as I was mentioning, I'm not here to tell you what you should do. As I was mentioning in the beginning itself, I just want to give you information. Now it is your choice. So my decision was to, or my position which I take is, I strongly advocate for a drug-free world. And now your decision matters. So that I hope all of you can take a wise decision. Yes, that's it. Yeah, thank you for giving me this opportunity. Because of a lot of material, I was going a little faster, and I was also not giving a chance for you to talk. But now I can take questions.
Sure, sir. Actually, there are a few questions in the chat.
Okay. Okay.
So somebody's asked, sir, is it the same working with the person who might be pica disorder?
Okay. See, pica or a pica disorder is actually, it's an eating disorder. Okay. So eating disorder, especially when a person is taking non-edible, non-nutritive substance. Okay. It is more of a eating disorder rather than a psychoactive substance disorder. So that is completely different one, and it has got a different line of treatment. Very good. It's there are people who are aware about these things, and I'm happy about that.
Okay, so next question: how to stop recalling negative incidents when that is the reason for the urge to use drugs? Crave triggers are past negative incidents.
Okay. One thing is that we need to know the nature of these negative events or incidents, because there are times people used to have something called a post-traumatic stress disorder. Like people would have undergone some kind of traumas which they are not able to forget. And flashback is one of the characteristic of PTSD. In abbreviation is PTSD, post-traumatic stress disorder. Flashback is like you are reliving the whole trauma in your memories again. And not just that memories, sometimes even people behave, they may lose touch with the reality, and they actually behave and respond to that kind of a situation, exactly like the situation how you responded in the previous situation. So is it related to a trauma, this negative experience? Then you need to take a proper psychological help. Okay, definitely that can help you. Or is it just a mood problem, or is it an anxiety problem? All these things you can take a professional help. It is available. But it depends on how intense it is. If it is too intense, we will not be able to deal with our own skills. We need to go for a professional ones.
The next question: when using illicit drugs, is it possible to stop using them without the help of de-addiction center if the person is a regular consumer of the drug cannabis? How to seek an escape from nicotine and alcohol?
Okay. Yeah, that's a good question. See, as I was mentioning, there is something called a withdrawal. Okay, so withdrawal is something happens when somebody who was using it for a long time, and when they stop it, they may get adverse negative physical effects of it. So for example, like if I've been using alcohol, when I stop alcohol, there is a chance I can get tremors. There is a chance that I can have insomnia, that is a sleeplessness. There is a chance that I can become irritable. I can become depressed. There is a chance that even I can have epilepsy. So there are different kinds of withdrawal symptoms can be there. If it is a nicotine problem, when I stop nicotine, generally withdrawal symptoms are not so prominent, but usually what we see is that decreased concentration can happen, irritability can happen, increased coughing can happen in nicotine. Whereas in cannabis, we don't have a specific withdrawal symptom as such reported yet. But then it doesn't mean that it doesn't have withdrawal. Cannabis do have withdrawal, but it is not a specific or a consistent one. People used to become they lose appetite. They have problems like emotivation syndrome. Emotivation syndrome means not having the motivation to do even the daily routines. So it can happen that way. They can have slowness in their thinking, even in their motor responses. Those kind of problems can happen. Okay. So whenever you think that these problems are coming, when you stopped on your own and these problems are coming, please don't wait. Just go and take help. There are medicines to help you to come out of these withdrawal symptoms, because sometimes people go back to drugs only because of these withdrawal symptoms. It's not that they want to use it again. It is only to avoid the withdrawal symptom, they go and start using it. Okay. So it is better you take treatment. Proper treatments are there which will help you.
Withdrawal symptoms will include pain, like nausea, vomiting?
Yeah, see, nausea, vomiting and all you can see in withdrawal. Okay, not as such, pain as such is not, we can't say. Nausea, vomiting, you can have in even in these things are common in opioids, withdrawals with opioids. So what happens is that you can have even running nose, you can have sneezing, continuous sneezing, you can have lacrimation, that is the tears keep coming. So there are varieties of withdrawal symptom. It depends on what kind of substance you have been using. And individually also, like how much you have been taking, and now your age, what is your age, your height, your weight, everything matters in these things. So we don't think that it is same for everyone.
Are all painkillers opioids?
See, these painkillers are opioids, okay, but not necessarily all painkillers are opioids.
Anybody else? Any questions? Any more questions, guys? No? Okay.
So, yeah, before winding up, let me just thank you, Ms. Maya and Ms. Srila, right? Srila, yeah, or Srila?
Srila. S-R-E-E-L.
Yeah, Srila. So as I was mentioning, I was just going through the not website, the LinkedIn and Insta, and so Mind Empower is doing a very good and wonderful job. So please continue to do this thing because a lot of students and other people will benefit from this. So all my wishes, and thanks to all the participants. Thank you for patiently listening to me and for being very interactive. Thank you.
Thank you, sir. Thank you so much. Guys, please do fill up the feedback form. We need this feedback form not only for the speaker, but also for us to know how we can do better. So please do fill it. And sir, thank you so much. Especially from your entire session, what I found a takeaway was how the brain actually works. You know, it was really enlightening how a small substance can alter the complete circuit. It is really very, I mean, it was very informative. So, and all your tips too. I'm sure if there are any of you who have friends who are going through, you know, issues with drugs, I'm sure if it's a small issue, I'm sure these tips might help. If it's greater, please ask them to go to a doctor. So thank you, sir. Thank you so much for this informative session.
Thank you all. Thank you.
Thank you, guys. Next
shall I
Saturday.
leave?
Yes, sir. Yes, sir. Thank you. Sir.
Okay.
Next
Thanks.
Saturday, we are having a session for coping with the loss of loved